Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Nash Foundation, others donate medical supplies to Lagos State government for the vulnerable experiencing rising cases and deaths from malaria during the pandemic. Edo government confirms rise in vaccination figures following the enforcement of its no COVID-19 vaccination card, no entry policy. And England launches its COVID-19 booster vaccination campaign for priority groups. And Nigeria recorded 299 new cases of COVID-19 infections with 3 new deaths. The Nigeria Center for Disease Control, NCDC, disclosed this in its update last night. According to the agency, the new cases were recorded in 15 states, with Lagos maintaining the highest figures, 201, followed by Ondo with 110 and 74 in Rivers. Meanwhile, almost 9,000 cases are still active in the country. Here's more on the update.
299 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 15 states and the FCT, indicating a drop from the figures reported earlier. Lagos, the epicenter of the disease, had the highest figures with 94 cases. 30 cases were recorded in the FCT. Oyo had 27, Bayelsa had 24, while 20 cases were recorded in Rivers. Edo and Taraba states recorded 17 cases each. Kwara had 15, Benue had 14, Delta 11, Osun 10, while Ekiti, Gombe, Plateau, Kano, Ogun State reported single-digit infections. There were 0 cases reported from Nasarawa and Sokoto states. The overall count of confirmed cases in Nigeria now stands at 200,356. 198 people have been discharged in the last 24 hours, increasing the total number of recoveries to 188,917. 3 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,640. Presently, there are more than 8,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. Over 4 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.6 million persons have been fully vaccinated. In Africa, there are more than 8 million confirmed cases and over 204,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 226 million, while more than 4.6 million deaths have been reported.
And over to Edo State, where the government says its policy and enforcement of no COVID-19 vaccination card, no entry into government offices is already yielding dividends, as evident in the latest COVID-19 vaccination statistics from the response team. The permanent secretary, Edo State Ministry of Health, says the enforcement had worked for many advanced countries before now, hence the reason the state government is confident that the process will improve the ongoing vaccination drive to contain the spread of the virus in this third wave.
We are not compelling people to take the vaccine, but we are encouraging people to take precautions to prevent them getting infected and also further spreading the virus in the state. And also we are trying to reduce the mortality alongside with the morbidity we are experiencing from COVID-19 pandemic that is still currently affecting Edo State amongst other states in the country. We have noted with interest that a significant number of the civil servants did not actually take the vaccines. But following these enforcement that we started, the turnout and the uptake of the vaccines has significantly increased. As much as most of them are not even civil servants, many other persons are now beginning to see the reality in this. It's important to also note that this is not this enforcement and measures that we are applying in Edo State is not peculiar to Edo State in the world. These are best practices to ensure that we minimize death and we stop the pandemic as fast and as early as possible. And that is why Edo State is adopting this, and we have seen it as the best thing to do. And if we do this, we'll have minimal deaths and more persons surviving COVID-19 disease in Edo State.
And still in the South, in Delta, more people are being encouraged to participate in the second phase of the vaccination program, which started off in the state earlier in the month. So far, over 1,200 people have been vaccinated with both the Oxford, AstraZeneca and the Moderna vaccines. Now, most accredited vaccination centres have taken the program to churches and worship centres as part of efforts geared towards more vaccinations. Well, joining us for more in Delta State is Dr. Michael Nwoko. He's the Senior Special Assistant on Health Monitoring. He joins us virtually. Thank you for joining us on the program.
Thank you so much, Millicent, for having me.
All right. Now, with over, perhaps one might say, only over 1,200 people vaccinated with both Oxford, AstraZeneca and Moderna, and this is since the start of the second phase, can we say the state is struggling to vaccinate its population?
Not really. Firstly, I'd like to thank His Excellency Senator Dr. Fayanto Kowa, the governor of Delta State, for creating an enabling environment for the vaccination program in the state. Yes, I cannot say that the state is struggling. I think the state is doing well when it comes to driving the vaccination program. You'll agree with me that we have been faced, with this challenge of, hesitance on the part of the people to get vaccinated. And so we are doing our best to carry out continuous advocacy and sensitization program on the need for the people to, get vaccinated. Delta State began the second phase of the vaccination program precisely on the 26th of August, 2021. That was after we received vaccines to kickstart the second phase of the vaccination program on the 25th of August in 2021. At that time, we received about 16,080 doses of the Oxford AstraZeneca vaccine. That is for the first and the second doses. Then we also received Moderna vaccine, and we received a total of about 87,038. That's for the first doses of the Moderna vaccine. And as I speak to you, from the data that we are tracking in the second phase of the vaccination program, Delta State has recorded a total of, that's for the Oxford AstraZeneca, total is about 14,135. And then for the Moderna, we have a total of about 36,470. That gives us a very good number, really, compared to what it used to be. As I speak to you, the states also have received from the National Primary Healthcare Development Agency about 47,000 doses of the Oxford AstraZeneca vaccine to encourage the states to continually drive its vaccination program. You see, what we are doing is to adopt a holistic approach so that whilst we have effectively mobilized the local immunization officers, of course, being coordinated by the state immunization officer through the State Primary Healthcare Development Agency. We are also encouraging the local immunization officers to move from one community to the other with a view to encouraging the people to take their vaccines. So the exercise, I think it is a huge success in Delta State, and we'll continue to do our best to ensure that the people get vaccinated. You see,
I must quickly come in, Dr. Nwoko, if I may, and this is to ask if you've received any shipment of the Johnson & Johnson vaccines.
At this time, we have not received any shipment of the Johnson & Johnson vaccine, but plans are underway for the Johnson & Johnson vaccines to be delivered to Delta State in no time. You see, whilst we are doing our best towards ensuring that people get vaccinated, by ensuring that our personnel are on the ground, and secondly, to ensuring that we continually drive this advocacy and sanitation program to encourage the people to get vaccinated, I think it is also important to ensure that the vaccines are available. But I think from what is happening now at the global, stage, international, stage, with respect to efforts towards ensuring that the unvaccinated population in Africa, a huge, number of unvaccinated population in Africa get vaccinated. I believe that more vaccines will be made available. It is not encouraging that in Africa, just about 3% of the population have been vaccinated, whilst in the United States we have about 53% of the adult population vaccinated. In the United Kingdom, we have about 60% of its adult population fully vaccinated. Israel has already achieved herd immunity.
Yes, but we both know that these are developed countries, and they have the money, they have the access, and they're making some of these vaccines, and that's what's happening. But I want us to come back home to Nigeria, and this is also what a neighboring state in the south, Edo State, is doing, and the government insisting on the vaccination mandate. Will Delta State be, taking that toll anytime soon?
Yes, Delta State is already making efforts. His Excellency, the governor, is on top of the situation, trying to activate the various pillars responsible for enforcing the vaccination program in the state. They're already making efforts, trying to send circulars to civil servants through the Delta State head of service towards ensuring that civil servants get vaccinated and ensure that they equally have evidence of their vaccination record.
What about those who feel it's against their sort of fundamental rights to insist on vaccination?
No, you see, it is not a compulsion. Are you getting? But it is necessary. What we are trying to do is to make the people understand that it is necessary, absolutely necessary, for them to get vaccinated and complete their vaccination record. The reason why this is imperative is because as far as COVID-19 is concerned, and as far as efforts that are required in order to ensuring that everyone is safe, no one is safe until everybody is safe. I try to, juxtapose what is happening at the international level because, you see, we're aware. Studies have shown that at this time, different variants of COVID-19 are currently on rampage among the unvaccinated population. And so no matter how much the West does its best in order to protect its citizens, other variants will also leave other regions of the world where the people have not recorded or achieved, reasonable, vaccination, data, to hunt them, via the different variants, etc. Via the different variants, etc. So that's the point. So what we make them to understand? What we make them to understand is very simple. Our message to them is very simple. That look, if they do not get vaccinated and guarantee their protection against COVID-19, that there are indications that this virus, if it gets into their system, it will go about mutation and now give birth to different variants of the virus.
It's a good place to leave it. It's a good place to leave it.
So it becomes more of a problem to the unvaccinated population.
We'd like to thank you. I wish we had more time, but thank you so much for taking out time today to join us. Dr. Michael Walker is the Senior Special Assistant on Health Monitoring, Delta State. Thanks again.
Thank you so much, Millicent, once again for having me.
Ebonyi State has distributed supplies of vaccines for the second phase, including the AstraZeneca and the Moderna vaccines. According to the state's immunization officer, the supply are stored safely and under the right temperature. It also adds that vaccination is in progress.
In Ebonyi State, we are working with 56 teams across the 13 LGAs. And the vaccine that was collected for AstraZeneca, which will be used for second dose for those that collected first dose, was 10,616. And for Moderna, which is to be used for first and second dose, was 46,088 doses. In this is not just limited as if it is the only vaccine out now for COVID-19. They are meant to know that other vaccines like Johnson & Johnson and Pfizer are available. But for us in Nigeria, these two are being used for now. And the first phase will run nationally from 16th to 5th September, 16th August, but for Ebonyi, we commenced on 24th, and it's supposed to end on the 13th. But plans are underway to extend it to 17th because we have not reached out.
Still to come on the program, we talk to a health economist on the coronavirus pandemic. Stay with us. We continue in the southeast Abia state. It has taken delivery of 55,020 doses of the Moderna vaccines and 6,928 doses of the AstraZeneca vaccine. According to the Executive Secretary and Chief Executive Officer, Abia State Primary Healthcare Development Agency, the response seems impressive with minimal hesitation from residents. She says the rapid and quick response to minimize the spread of the virus has necessitated a quick action by the department, including the disbursement of vaccines to local government areas where it can be accessible.
A lot of information and messages have flooded the media. People are just posting anything they like. But I want to tell you that those facts, those issues are unfounded. We've asked those who brought those messages, come forward and prove your points. They are not true. They are not true. The vaccines are safe. There is no regret in any way. The AstraZeneca vaccine tested and is effective. It can handle of course, we've not had any casualty since March that we started. Those we administered have not contracted the disease up till now. We've not recorded any. So that is a point. I think they should rather concentrate on something meaningful than going about spreading unfounded rumors. We want to ensure that we vaccinate at least 40% of Nigerians so that we can have a kind of herd immunity. If you can vaccinate up to 40%, you can talk about herd immunity. But for now, it's just low, a little bit above 1-2% of the population. So we've not even started. We look at the population of every state before distribution. So what we got is just commensurate with the population and the number of cases we've been having in Abia. So generally, it's just about 1% of the population.
Well, away from Nigeria, but staying in Africa, COVID-19 pandemic exposed the vulnerabilities and placed tremendous financial pressure on a lot of aspects of the healthcare system in Africa. To talk more about this, joining us is Dr. Ama Puka-Feni from the Institute of Statistical, Social and Economic Research, University of Ghana, Legon. We'd like to thank you for joining us on the program.
Thank you very much for having me.
All right, let's first look at Ghana, where you are, and the COVID-19 response. Would you say that the worst is over?
I would not say that. We have currently been informed that there are a few strains of the Delta variant in different parts of the country. We have had a very strong COVID response. The initial measures that were taken by the government have been very great. We were the first country in Africa to actually have access to the COVAX facility. And since then, we've had some more doses of the vaccines coming in. We do have a very good supply chain system for routine vaccines, which has really helped us. But to say that we are out of the woods, no, I would say we still have to keep on making sure that people apply these protocols, COVID-19 protocols, to avert any more deaths in the country.
Let's look at Dr. Feni, let's look at the broader measures. Has Africa thoroughly analyzed the costs, the benefits of the current initiatives? If you take the vaccination campaign, for example, is it organized in the most efficient and most cost-effective way?
Again, there have been a few studies, for example, studies on the impact of GDP across different countries in Africa. So we know for sure, we have evidence to show that countries' GDPs have declined over the past 2 years. But then there's still a lot of room for more impact assessments to know how COVID has affected how jobs, education, employment. There are so many other parts of this story that we need to put together. And it brings to mind one of the areas that we need to focus on, investments in research and development, which is really lacking. One of the things I'm really aware of now is the fact that Africa CDC has done has has a few estimates about how much it will cost us as a continent to be able to acquire 1.5 billion doses. That's in the region of about $10 billion for 60% of the population in Africa. But there's still a lot more we can do. So there's priority setting, there's evidence cases that we need to come up with. There are so many other research that we need to invest in. And maybe this is a wake-up call for us to continue investing in research and development across the continent.
So in terms of perhaps post-pandemic, what would you say our global health goal should be as a continent?
So financing is key. We have seen throughout the response across the different nations our reliance on external partners. The World Bank, for example, has sustained the recovery of several countries in Africa, supporting with resources and finances. And we really look at how much we need to keep on vaccinating the huge numbers of people who have not been vaccinated as of now. And so the cost implications, the supply chain, the cold chain, everything to do with the health sector and even the broader health system and other areas that we need to invest in. I think financing is key. We have seen the impact of having no funds and having to go to the open market because you don't have the funds to actually get the vaccines you need. So yes, funding is key in all of this, and there's a lot of work to do in Africa.
We appreciate your time. Thank you so much, Dr. Amma Pukafeni from the Institute of Statistical, Social and Economic Research, University of Ghana. Always a pleasure. Thank you for joining us on the program.
Thank you so much for having me. It's a pleasure.
And we're back in Nigeria. Many diseases received less attention because of COVID-19 pandemic, occupying most spaces, and people were afraid of contracting it from hospitals. And malaria is one of such diseases, but the Nigeria Entrepreneurship Summit and Honors Foundation, NESH, is set to change that in Lagos with donations of anti-malaria materials.
There have been tales of immunization appointments missed, cancer getting critical, and deaths from malaria, all due to the COVID-19 pandemic, which occupied health personnel and frightened patients with other ailments away. The Nigeria Entrepreneurship Summit and Honors Foundation, NESH, is lending a helping hand to Lagos to keep the fight against malaria strong with diagnostic and therapeutic equipment. Although Lagos State has one of the lowest incidents of malaria in the country, these tools will come in handy.
I can see into the future that a urine diagnosis for malaria is going to be a very, very important way of slowing down the impact of malaria on our population, giving us the ability to make quick diagnosis and treat appropriately.
NESH and its partners are assuring Nigerians that this is a continuous exercise, and the founder is particularly happy about the relatively new urine malaria test kit.
It's very innovative and very user-friendly, and it's the first urine malaria test in the world. And it happens that the founder of Fiode Biotechnologies is a Nigerian.
COVID has a perfect way of mimicking malaria symptoms. So what this is about is to say we must test before we treat. But saying test before we treat is not enough. What's more important is ensuring that we do not lose lives owed to what I would call guesswork and wrong diagnosis, which is what has been the case over the years, really.
The donations include prophylactic tablets, NAFDAC-approved do-it-yourself urine malaria test kits, and anti-malaria antihistamine combination therapy options. Experts say it's important to test before treating, and while the test kits give an idea if it could be malaria, tests at the lab cannot be overemphasized.
France has suspended about 3,000 health workers over not being vaccinated against the coronavirus. A new rule, which came into force on Wednesday, made vaccination mandatory for the country's 2.7 million healthcare, home and fire service staff. The country's health minister says most of the suspensions are only temporary.
The suspensions have not gone down well with the health workers. One of them, Thierry Pesson, has decided to protest his. He says while he's not against the vaccination itself, he's against people being forced to get the shot or risk losing their jobs. He's now on a hunger strike, hoping to amplify the voices of ordinary people who are uncomfortable about the vaccine mandates.
Yes. You're happy to have your booster dose today? Yes.
Over in the UK, England has launched its COVID-19 booster vaccination campaign with members of the National Health Service receiving the first doses. Staff at Croydon University Hospital in London say they were feeling confident going into winter after having the booster jabs. Booster vaccinations will be given at least 6 months after people received their second dose of COVID-19 vaccines, meaning the rollouts will roughly form a key plank of plans to navigate the winter without further lockdowns. Russian President Vladimir Putin says he would have to spend a few days in self-isolation after dozens of people in his entourage fell ill with COVID. He was speaking through a video link at a summit of a Russia-led security bloc, which was held in Tajikistan. He had planned to attend in person before the news on the virus outbreak in his inner circle this week. Finally, Italy's government is set to make its COVID-19 Green Pass mandatory for all workers, becoming the first European country to do so, as it tries to accelerate vaccinations and stamp out infections. The measure is expected to come into effect in October.
Don't forget to take responsibility. You can visit our website. It's channelstv.com. You find breaking news, several other stories, a better understanding of the coronavirus pandemic. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.